Hi, everybody. This is a podcast where real medical professionals discuss fake medical emergencies. That means that unless you forgot to retract your adamantium claws before going to the bathroom, this podcast is not medical advice. If you need medical advice or medical care, please contact your doctor.
Hi, everybody. I'm Jackson Vane.
I'm Johnny Kolosinski. You might remember me from such podcasts as Could I Be Any More Enlightened? The Buddhist Wisdom of Chandler Bing.
God damn it. That's terrible.
That's true.
That's horrible.
This is Hi, Everybody, a bad medicine podcast. Every week we talk about what Hollywood gets right. This is a podcast where we talk about what Hollywood gets right and wrong about medicine and how the body works. With this week, once again, our two wonderful guests, Dr. Greg Winter.
Hi, everybody.
He said the name of the show.
Oh, my God.
And Dr. Courtney Nicholas.
Hello.
You can find this podcast, by the way, on iTunes, Apple Podcasts, Stitcher, Google Play Music, and on Instagram, Facebook, and
Spotify.
Twitter, and Spotify at Hi Everybody MD. What are we talking about this weekend for Horrortober?
Horrortober's movie number 3. It's going to be Saw 2, the 2005 classic horror movie, kind of, but not really.
Starring the cheaper Wahlberg.
It is. It is great value Wahlberg, Donnie Wahlberg, who is married to Jenny McCarthy.
Yeah. This is a podcast all about how vaccines are bad. Or this is a movie about how editing that bit.
Everyone in this movie wants a vaccine.
This is true.
It's
Oh my gosh, how did this marriage happen?
This is solely
Life imitates art.
Yeah.
Imitates life.
Everyone is actively chasing after needles to inject themselves with stuff to save themselves.
One person gets a lot of vaccines.
Yeah.
Oh yeah.
I don't think those are vaccines.
In case anybody's curious, this podcast is proof that none of us are the Masked Singer.
Oh come on. Why would you make that horrible joke?
Have you listened to our shows?
Oh yeah, true, fair.
So why did we choose Saw 2?
Because it's Horrortober and there's a
Horrortober.
Sorry. Thank you. The joke continues forever. I think there was a lot of just good scenes about bad medicine in this whole movie, which essentially is the entire Saw series, I would say. We didn't want to do Saw 1 because there wasn't enough stuff to talk about, and the other ones just got a little too crazy. This just had the right amount of crazy.
Just the right amount of nonsense.
Yeah, just the right amount of nonsense. I mean, it starts off with a bang. No pun intended. But it was a guy. Yeah. But this was a guy with the death mask on him.
Mm-hmm.
And they said that he would see his answer somewhere.
And then you see the x-ray of a key in his eye socket. For those of you who don't know me, I've got one eye and a prosthetic. Eye trauma is a big old nope from me.
But you won the game, right? So you were able to escape Jigsaw.
You got the key out of it.
I mean, they showed an X-ray. The thing that kind of was a little crazy was they showed the X-ray of the key floating on top of the eye socket. Like, it didn't look like it was pointing inwards or anything like that.
Yeah, I'm thinking about this more and more, and it's like, if the key is where they showed it, it's basically just sitting in his eye socket, which you don't have to do anything to get. You just can pull it out. It's already been, the eye is already destroyed when you put the key in there, so you just take it out.
Just fish it out a little bit, and that's it. I mean, or it was going to be on the skin, because the way the X-ray looked like, it was sitting outside of the socket.
Yeah.
It did, but you couldn't see it on his face.
No.
You
No,
saw the
you just saw
orbit,
gruesome...
and you saw the ball of his eye,
Yeah.
but you didn't see the key.
I think his problem was not knowing anatomy and knowing how easy it would probably be to get that key out. He just had an idea of where the key is.
Yeah.
And he's like, well, I got to go through my eye. I don't think either it's right there and you can get it, or it's kind of in the skin and you don't want to cut through your eye to do that.
So if Jigsaw is going to take out one person on this podcast, it's going to be me.
But it's going to be really easy, though, because he just has to, like, lift up your prosthetic and just slide it in, and then you're set right there.
So how would you guys, this is going to be another, please delete this so we can be doctors moment. How would you guys hide a key in someone's eye socket or behind someone's eye?
Use a smaller key.
Yeah, if you're going to hide it, you're going to have to use a smaller key.
But that wouldn't cause the damage that he was looking for.
I mean, either that or hide it under the bone part, and then make him dig for it. But the other thing is, when he put the knife or whatever it was into his eyeball, it was really bloody. And the eye itself isn't that bloody, at least at the point where he
the eye has different stuff in it. There's
goop.
goop in the
It's
eye.
goop.
There isn't blood in the eye. And that's the other thing I was thinking about. Is like, if you get hit in the eye, is it your eye that's hurting, or is it your skin and all the other stuff that's hurting? Your eye can feel pressure.
Your eye can can feel pain. Because trust me, I get eyelashes behind my prosthetic.
I scratched my cornea.
Yes.
That
I also got
one of the most painful things ever.
Yes.
This is medical advice, guys. If you have a prosthetic eye and you're eating hot sauce, don't
touch your prosthetic eye.
Don't touch your prosthetic eye. And if you do, don't go to the bathroom. Wash your eye.
Yeah.
Because what that's going to lead to is I can't drive home because I cannot keep my eyes open.
Because I can't see out of that eye anymore?
Because I couldn't keep my other... Yes, I can't see out of my glass eye.
Okay.
Yeah, that's exactly what was happening.
Your eyes are accommodating.
I couldn't keep any eyes open because I was in excruciating pain because of Skyline hot sauce behind my prosthetic.
One could argue that if you have hot sauce on your hands, you shouldn't touch your other eye either.
Yeah, maybe wash your hands before going to the bathroom.
I thought this was going to go a totally different direction. Like, one would say if you had hot sauce, you shouldn't touch many parts of your body. No, that's just a no-no in general in that part.
Let's stick to touching napkins.
Soap and water.
Soap and water is probably the best thing you can do to help you out. And probably avoid touching anything that's mucosal that can get irritated.
Mucosal.
Wink.
Don't create a human centipede after touching hot sauce.
Yeah.
Oh man, that would suck.
Can you imagine if that front guy ate like hot sauce or something like that? It'd just make a horrible human centipede.
I think that's what everyone imagines. What if that guy didn't have a pleasant meal?
Spicy kibble.
I'm just speechless right now with this look of horror on my face.
But, yep.
Horrortober.
Yes, correct. So we go back to like the main story because that was just like the appetizer, the amuse-bouche, you might say, for this whole entire movie.
I have one question about the amuse-bouche.
Yep.
So Jigsaw, who's the spoilers, the bad guy. He's the okay guy.
Yeah.
He's basically trying to answer the questions of why man great till he gotta be great. He cuts out a jigsaw puzzle piece out of all of his victims.
Yeah.
Is that something? Could he get that specific of a sample?
Yeah, I mean,
Yes.
if you use something sharp enough, you can definitely do it. And when you do biopsies of moles on people, you're usually making some nice clean incisions and then taking that chunk of skin out. So if you want to be fancy one day and do a really nice skin biopsy, you can always make a jigsaw in there and take the skin out.
And then talk to your local medical board about why you did that. Because
I thought it would look cool.
Yeah, because I'm kind of thinking now I want to carve my initials in, but it's probably something I can only do on myself.
someone got arrested for doing that.
Yeah.
A doctor got arrested for doing that
Plastic
inside
surgeon,
of someone's
right?
body.
Really?
No.
Was doing it on their liver.
Oh no!
Yeah,
Yeah, there was a guy who was like,
yeah.
like
I haven't
actually
heard
cauterizing it too,
Yeah.
and not just cutting, but burning it in.
Like that's the thing. Like he only got caught because somebody had another surgery, and they're
And they
like,
saw-
"What is this?
Why are there initials?"
initials in somebody?"
You basically he was basically doing graffiti in someone's abdomen.
Like Dr. God was here.
Kilroy was here.
Yeah.
Yeah. And then just drew like a little
Wow.
face there and just left
Wow.
it there.
Anyway,
Yeah. So
doctors
I guess
can be kind of messed up.
Yeah, but to answer your question, yeah, you can do a nice
Yeah.
little carving
I
like
think
that.
you could.
There is a little tool that you use in the office to do punch biopsies. That's these little circular so if you want to look at some part of someone's skin for skin cancer, and that's just it's like a little tool that's a perfect circle, and you punch it out, and you actually take that piece of skin and you lift it up, and you can kind of cut off the bottom. You get really nice clean edges. It looks really nice. To do something like that, you would need a stencil, or you would have to be pretty good freehand.
Mm-hmm.
But then you need something that's really sharp so that you can get nice clean edges. And then there are dissecting tools that kind of put tension on your skin, and your skin will peel back like that.
Just like when you were dissecting things in biology class.
Yeah,
and you
things
peel
are
stuff back.
things are very layered in your body, and if you have the right tools, you could do that.
So Shrek was medically accurate when it said that people have layers like an onion.
I think they were talking about what makes them complex as opposed to the actual physical layers of their body.
Emotionally. Although the
Emotionally
skin
complex.
does have layers.
It does, but
Like an onion.
Like an onion.
Yeah. And that's the other part too, is like when they try to remove all the skin, they have to really dissect each layer out. and I don't think it makes it look like it's just as simple as cutting it and then just lifting it.
Yeah. It looked like cutting fat off a steak.
So, I mean, if you were watching it in real time, when people are making incisions that they want to be kind of nice and clean incisions, they put tension on the skin so that it's not bunched up. Your skin is a little bit elastic, so they put tension so they can get a nice clean line. And then after you make a line, because skin is elastic, you can really stretch it out and you can pull those layers up. I mean, people that are good at, surgeons who are presumably good at dissecting, they make it look very easy. It's pretty difficult to do, and there's all these techniques to kind of pull the layers away from each other and to expose the things that you want to see.
Do you still call it dissecting when it's not a lab situation?
I was thinking about that as I said it, and I don't know.
Yes.
Yeah, there you go. Courtney knows.
You dissect out to get to what you're looking at, what you're looking for, anything you want to repair, or whatever you're doing with the surgery. You have to kind of dissect out the area.
So I guess going back to the storyline part, SWAT finally does find Jigsaw, and he's like on chemo, but he looks really good for a guy on chemo, I have to say.
Yeah, everyone's different. Chemo affects different people differently. Who knows what type of chemo it's on? There are times in this movie where he looks very, very frail, and other times where he's really taken a beating pretty well.
Yeah, like I think at one point he just randomly just puffs on oxygen just because he's sick.
It lets you know
he's sick.
He's sick.
Maybe he was just puffing on epinephrine like we saw in Flatliners last week.
Oh, God. That was terrible because that's how they brought people back to life. Instead of giving them injections, they actually were puffing on epinephrine just to get them back.
That would be awesome.
If that worked.
If that worked, that would make my life so much easier.
if he had terminal croup, then yeah.
Medicine is really specialized, and it's like, does that work? I have no idea what people do for any of that stuff.
So usually we don't use it.
No, I can tell clearly that's a preposterous thing, but I don't use it. So what do I know?
There are two ways that I give epinephrine: through the veins or down the ET tube, straight into the lungs. Breathing would be awesome.
Wait, so you're applying it to the lungs, but you're not applying it.
It's a liquid, and so we put a breathing tube in, put the patient on the ventilator, and then you just pour the epinephrine down the ET tube.
I'm picturing
Yes.
like a chicken with a funnel sort of thing, which is probably not quite.
No. We're not gavaging this kid.
Like, why are you giving it in their lungs as opposed to injecting it?
In the delivery room, if we don't have venous access and a baby is coding, then the first thing is you want to get them breathing. So you intubate them, and if their heart rate goes down and they need epinephrine, you don't have any way to give it in the veins, then you pour it down the ET tube.
Yep. Why aren't you doing IO?
Because their bones are too thin, and you're gonna drill straight through their leg.
So technically, you can give a neonate an IO, but it's faster.
It is faster
down
to
the
do
ET tube.
What about nebulized? What about
if it works in Flatliners, then I'm going to bring it into the delivery room.
Yes, because there's one thing we learned from Flatliners. It's that everything that works in Flatliners works in real life.
Yeah.
Yes.
We do use... There's studies about nebulized morphine and about nebulized lorazepam, but they don't do anything.
We use nebulized lorazepam. Wait, let me think about this. No, we use intranasal lorazepam. So it's liquid form and it goes in the nose.
We use intranasal Versed all the time for anxiolysis. But we also use nebulized ketamine at times, and there's studies for that to reduce suicidality. It's not fully approved yet, but it's actually one of the
I use ketamine all the time for depression.
Ketamine's great.
Have you seen all the recent studies on mushrooms and depression?
Yep.
Coming out of Hopkins? It's pretty impressive.
It's coming out of Colorado.
Oh, is it?
Yeah, that was one of my fellowship teachers that's doing that shit.
When is it coming to Kaiser Permanente?
It's legal in Colorado.
Mushrooms?
It is now legal.
Nice.
So
anyway,
this is all staying in, by the way. This was fascinating. Greg, I want to talk a little bit about your specialty, which is palliative care, end of life care.
We'll get there. I have notes for later in there.
Okay. Oh, great. About whether building torture rooms is...
Well, why don't you ask me? I shouldn't have cut you off.
Yeah. How often is something that as you're working with your patients, is building a torture room to torture those who have wronged you and your underlings.
To be fair, he's not torturing them because they wronged him. He's torturing them so that they can appreciate living in the future and
that is what
appreciate life.
He does want them to succeed.
He wants them to succeed so that they can better enjoy life.
I think there's a part of him that wants them to fail. I think. He got really smirky before poor man's Mark Wahlberg started hitting
That's
him.
Saw 3.
Okay.
Spoiler alert.
I mean, this guy's pretty vindictive, and I think they go into it in Saw 1 more about his diagnosis and how that led him to do this because he wanted people to appreciate life. Although Saw 1 is a better movie. But, I mean, I know it's not a psychiatry podcast, but psychiatry is part of medicine. It should count. He says, and it does count. So
it does count.
It does count.
But he's talking to Donnie Dubs and says, I've never murdered anyone in my life. What he's doing is murder. Like, there's no...
The machine's murdered. They all had a chance to live.
I mean, that's a... what is that?
I'm playing Jigsaw's advocate here.
That's a philosophy question about if you build a machine to murder people and the machine murders people, are you the murderer? Like, yeah.
The amount of time "what is murder" has come up on this podcast it makes me a little uncomfortable, especially knowing the Google indexes everything.
I will say I feel like I missed a bit. I'm a bit stepped back because I did not see Saw 1. And so
you don't need to. Yeah.
Well, it was good you guys kind of explained little bits here and there, but never see a sequel.
Jigsaw felt
first.
wronged. Someone didn't diagnose his cancer properly, and then he was found out to be terminal, and now he takes it out on him.
And Wesley from Princess Bride is in it.
Correct.
Best part.
Yeah.
You're saying that you're willing to see Human Centipede 2 because you've seen the first one.
The full
I
sequence?
did not go there.
I didn't. There's this part in the movie where he's pontificating a little bit and talking about, you know, what it means to appreciate life and how people are broken. And it's like a both good and a bad speech. I'm trying to look at the stuff that I wrote right now.
It's Jigsaw's last lecture.
Yeah.
Yeah, he says a couple things in there. He says the knowledge of your own death changes everything completely. And he's talking about knowing the exact day and time he's going to die, and how when he was in the hospital, someone came in and told him. That's a thing that does happen in real life. I have had to do those conversations with people. I have never given someone an exact day or time, but that is something that often gets told to people. They get told they have 6 months to live or a week to live or something like that. In my line of work, we try to be real careful with that language. We are very general. None of that stuff is up to us. Nobody knows how long somebody's really gonna live. But that is often how patients hear that, and I can totally see from his perspective, that's like a big life-changing moment. It puts your whole life in perspective, kind of changes how you're going to do things moving forward. I do hospice care, so I'm doing end-of-life care for people all the time, and they often, they talk about that moment, and they also talk about how it makes them appreciate life more. So that's a thing that I totally was like, oh, that was, that's kind of like real life. He's a little melodramatic about it. But yeah, if you've had some scary experience, usually you appreciate life a little bit better for at least a little while before things kind of go back to normal.
I think that's fair.
I'll get off my soapbox.
And therein lies the creation of the next Jigsaw.
Yeah.
Right, exactly. Right?
How many are there?
What?
Jigsaws?
There's one Jigsaw. Well, actually, if
There's
spoiler
Jigsaw,
alert.
Yeah, spoiler alert. We're
There's
not Jigsaw Junior.
There's like 3 Jigsaws in the whole series.
No, but how many movies?
Oh, in the whole movies is 6. 6 or 7, I believe. So a lot.
And a new one on the way.
Yeah.
Hooray!
In a baby Jigsaw.
Congratulations, you're expecting a Jigsaw.
Yeah.
It's interesting to hear you talk about that too, because when you're telling people, trying to gauge how long their life is, but not giving definitive periods of time, it changes how they see their life and how they focus on what they're going to do. And in my line of work,
You're a neonatologist.
I'm a neonatologist, so I take care of babies in the ICU, some of whom are very sick, and unfortunately some of whom don't survive. We have to do something similar to that, but the receptive side of that is not how am I going to change my life or how am I going to make the most of what time I have left, but how am I going to prepare for losing my child? And I've learned very quickly that we know nothing about timing. Like,
Yeah.
I've had, patients who I thought for sure were not going to survive. And, 2 months later, they're going home and their mothers are writing me notes saying, thank you for letting my son prove medicine wrong. And so I've just given up trying to pigeonhole that.
For me, on the ER side, I just go, someone else will tell you.
It's weird because you get a significant diagnosis, and of course that is a legitimate question to ask that helps you frame what you're going to do moving forward. And I think doctors want to be helpful, but also often have a hard time saying, I don't know. And this is a moment where people need to be saying, I don't know more.
Absolutely.
Yeah, there is certainly you can use experience to kind of guide what frame we're talking about, but I think I have a lot of patients that were told something specific, like 4 weeks, and it's like, that is a meaningful time frame to tell somebody, but it's also based on sort of nothing. It's you can't.
Everyone's
really
different. Everyone processes the disease differently. The disease could affect other people differently. It's impossible to guess that kind of stuff. So I would agree with you on that part.
This is the most maudlin episode of the podcast we've done.
Seriously.
So let's
Can we get back to shenanigans?
Yeah, let's get back to shenanigans.
Somebody's saying funny shit.
Yeah.
So, they find Jigsaw, and then Jigsaw reveals his magnificent plan that he locked a bunch of people inside of a house and they have 2 hours to live because he released, and I quote, they are breathing in the same nerve agent in the Tokyo train attacks.
So sarin gas.
So sarin gas.
What does sarin gas do?
Yeah, sarin gas is an organophosphate, so it causes you, as I teach all my residents, it makes you leak out of every orifice in your body.
Oh wait, so that was accurate.
No.
They were a little sweaty, but I think we were discussing.
His description was accurate, at least.
What was his description?
He described it as he'll be bleeding from every orifice.
They don't bleed from every orifice.
Bleed.
That's the difference. They leak from every orifice.
Leak everything else.
Yes.
So whatever would normally come from that orifice is going to come out of that orifice.
Tears, running, like snot, drool, pee, poop, sweat. You're a very juicy person.
Yeah. Everything wants to come out that's in there. Your blood is in a different system.
Yeah. So you don't necessarily cough up blood. You just become very juicy.
Yeah.
And
you'd be phlegmy, but not bloody.
Correct. And I've only seen one case of an organophosphate thing, and it was when I was in New Mexico, and it's rural, so insecticides.
Pesticides,
yeah, pesticides, and that kid was super sweaty, very hard to control. The nurses couldn't hold his arm to do an IV because he was so slippery.
Oh.
When I tried to put a breathing tube in, it was just mounds and mounds of drool, so I'm suctioning the whole time. And then, of course, he's just a stinky mess, too, because when you're leaky, so everything comes out.
This might not be something you know, but is sarin something that's based on an insecticide or...
I'm not sure. I know it's chemical warfare.
Right.
And it was used by that cult
in Japan.
In Japan, yeah, to do all that stuff.
And so what they show in this movie is people coughing up blood. That's the signifier that things are moving along. There's not any gas I can think of that makes people do that.
Tuberculosis gas.
So people cough up blood from if they've swallowed blood.
Yeah.
If they have lung cancer.
If they have something
tuberculosis. If they have injury to the inside of their lung, that's when people are coughing up blood.
I mean, sarin gas is known as causing something called the killer bees, which is bronchospasm and then bronchorrhea. So sometimes if you fill up your lungs enough with fluid and you start breaking down tissue inside of your lungs, you may cough up blood, but you're probably going to cough up bloody sputum and not just frank blood. And that's the bigger difference.
And they were coughing up blood like it was no big deal.
Yeah.
Bring it up, spit it out. No, I'm good. I'm good.
You'd expect them to look a lot more pale or gurgling a little more.
See, these are otherwise healthy people. I'm okay. I think they took some okay artistic license. I have patients that cough up blood. They look okay.
Donnie Wahlberg's kid did not look in great shape.
He did not look like he was in great shape. He
looked like he was in bad shape before the movie even started.
He has 3 cigarettes to start the day.
Yeah.
So yeah, that's what I'm saying. So they cough up blood, and that's the thing they show a lot in movies to show someone is sick. I think it's way less common than that. Yeah. There are those few things that kind of cause you to cough up blood, or you could have bloody sputum from that.
Also, I would say another time I'd see people cough up blood is if their throat was really sore, and they cough up a little bit of blood.
Yeah.
But it's like a streak of blood and a bunch of spit.
Yeah, if you're coughing a lot and if it irritated your throat, that can definitely cause you to have some blood in there. But I was thinking about what could get somebody to have blood coming out of their mouth, because this happens all the time. It's in movies all the time. And the medicine Coumadin that we use for blood thinner, that is something where if you overdose on it, you can have bleeding out of any of your orifices. One of those.
Yeah.
Holes.
But
bleeding out of your holes.
But so if you have too much of that, you can have spontaneous bleeding. It's probably less that you're coughing up blood and more that coughing is causing just some damage in your mucosa, and then it's going to cause your blood just won't clot.
Yeah.
That's the same medicine they use for rat poison.
So everyone kidnapped was on Coumadin.
There we go.
Yeah. You gave them Coumadin and sarin gas.
Just, for dramatic effect.
I mean, if you really want to kill them.
It's Hollywood, so you have to have something that you can see. And
right.
The sweating is okay, but
having a slightly mucusy cough is not dramatic enough for Hollywood.
And it would also turn into a comedy if everyone just crapped their pants and just tried to go through the whole thing.
It's hard to have a serious crap your pants move.
Just hear fart noises as they're running from obstacle to obstacle. Just doesn't work as well.
I don't know. Terrence and Phillips' list was.
That was a good one.
That was an Oscar winner.
That was an Oscar winner.
And then not so much with coughing, but with throwing up, someone who's a heavy drinker can have dilated vessels around the esophagus, and they can vomit blood pretty easily too.
Yeah, but I mean, all those people were allegedly bad people, so they probably could have done that too. If they were heavy drinkers.
They just all happen to have separate reasons for coughing up blood.
And one's on Coumadin.
6 people have been brought to a house.
It's the real world?
The
real world Saw House.
With
Real
death
world
masks.
epistaxis.
Exactly. Can I ask everyone a question? Why does everyone stare in the flashlight before turning it on? I know.
Oh, Jackson.
I mean...
I'm sorry, Jackson. You can't do that. Courtney said that.
I know.
You can't take that away from her.
She didn't take notes, and right when she asked that, I wrote it down right away.
Because you were writing it down too.
And that's why I wanted to ask.
It's a valid question.
It is a valid question.
It does not need to be attributed to anyone.
I know we're not a flashlight podcast, but wouldn't that blind you?
Think about it. Every single movie you've ever seen, someone is hitting a flashlight, trying to see if it works, and turns it on directly into their eyes.
I have only done that when, yes, it turns out it's dead. I was right.
Also, I mean, in real life, I have hit a flashlight, and it has kind of turned back on a little bit again. It is now not a working flashlight. It is a flashlight that worked for about 2 seconds. You don't have to shake a flashlight. Either that flashlight is working or it is not working.
Yeah,
that battery.
It's not a shake weight flashlight.
Right.
I did have a crank flashlight that I had in my emergency kit where you would you'd squeeze the handle on it and it'd run for 5 minutes.
Oh, that's a totally different type of crank flashlight I thought of.
Yeah, as opposed to
Not Chelio's flashlight.
Yeah,
that flashlight
the faster I ran, the brighter it was.
They have solar flashlights too. All of those solar batteries that you get have flashlights on the back of them. Charge your phone.
That's great if you're camping and you're outdoors and things like that, but not for your emergency kit on day one.
This is true. Or if you're locked in a dungeon with somebody trying to kill you.
Without a window.
And especially if you want to go back to that whole thing, when you shine the light...
You mean the movie? Oh, no, the flashlights.
Yeah, but if you shine the flashlight in your eyes and you're in a dark room, you're blinded for a little bit. Yeah. You're kind of screwed yourself over for a little while.
Do you remember what the chemical's called in your eyes that allows you to see in the dark? I don't know why I know
Magic?
Rhodopsin?
Rhodopsin.
Yeah.
It is rhodopsin.
Yeah.
In the rods.
Why do you know that?
I know a lot of random stuff. You know this.
That's insane.
That's why I play trivia.
That is like my one piece of medical trivia that I know.
That's why I play trivia all the time. It's just how it works.
Oh my god, trivia last week had something all about neonatology and I missed it.
I missed
epistaxis. Oh, shame. Mm-hmm. I should break out the shame book for that
They called it storkology.
Oh, that's terrible.
Are you gonna get a new coat?
Wait, what
was
the
storkologist?
What was the question?
You want to know?
Was it just like...
No, it was like a whole list of questions. Like, what's the white stuff on a baby when they're born?
Vernix.
And what...
Did you know that one?
I knew all of them, but I wasn't there.
Oh, you missed them because you weren't there.
I thought you missed the question.
Yeah, I thought you...
No. I got all of them right, it would have been perfect.
I got epistaxis wrong, and I was so upset. I was like hitting...
Epistaxis means bloody nose,
This is not
guys.
going in there.
No.
It might. Who knows?
It was, what does epistaxis mean? And I was like, oh, that's when you're vomiting blood. And as I was hitting it, I was like, nope, that's a nosebleed.
Oh, no.
That would be hematemesis.
Yeah.
So, talking about Obi's game, he crawls into a furnace to look for one of the antidote things. And then the door just slams and he gets burned alive in there. And there was a way for him to escape, but when they broke the window for him to come out, he didn't look that burnt.
He really didn't look that burnt, and I think that's because convincing burn makeup is expensive.
I also think that it's because all of the burns were happening on the lower half of his body, and it was moving its way forward.
That's true. But his clothes would have been more burnt.
His clothes would have been
yeah.
so...
And it was all lit up right on the other side of the window before they broke the window, too.
True.
And he just kind of popped his head out, and all of a sudden the fire was gone on that side.
Because he should have started steaming up. I'd expect
Wait,
more.
steaming up?
He's steaming up?
Yeah.
Not an NBA Jam podcast, Jackson.
That's fire.
I know.
But he should have looked a lot like redder, bloodier, more irritated, and he looked like nothing.
He had a couple burnt patches of hair.
So the other thing about fire
Barely.
is that it damages you very quickly. It is
Yes.
not a subtle thing that happens with time. If you have ever touched a hot stove, you
Or
know
been
that,
a fire breather.
right? I mean, your skin is damaged very quickly. He would have been in a lot of trouble very quickly in that scene. That was a very cringy scene. We were all uncomfortable watching it.
I mean, it's not the cringiest.
Uncomfortable
Yeah, that's
as
not
doctors, or uncomfortable as...
Human being.
I think
Like,
as
as
humans
human-
with skin who have
Yeah,
all burned
got it.
themselves.
Well, and he was in a furnace, too, so the heat would have been intensified. Forget about the flames, but it must have been...
It's not the heat, it's the
Pretty
humidity.
In this case...
Terrible. So terrible.
Number one, we live in San Diego. It's neither, because it's great.
Yeah.
And
You know, that furnace has got kind of a dry heat.
yeah, it's a dry.
It's a little dry.
He'll be just fine.
But the other thing too is like the oxygen would have all been sucked away too.
Right.
If he was in that tight of a room. So he probably would have not been able to breathe for a while. And he probably would have passed out before he made it out of that window.
It was a quick scene. I don't know.
Relatively quick.
So the way he was supposed to get out of it was on the other side of where the fire was coming from was a knob to turn off the gas.
Yes, there was a little devil there that said twist.
Yeah, and so that knob was inside the furnace. It was clearly made of metal. That's one of those things where had he grabbed it, it would have been a very punishing thing for his palm.
Mm-hmm.
The whole thing, when you have fire damage or heat damage to your body, that reaction is really, really quick. That is where you have skin that sloughs off. That is where you you burn the inside of your lungs. That's actually what causes a lot of death or secondary issues with people, is that they're actually burned on the inside of their body. This is just a horrible thing to see. Granted, it was
pretty sterile.
This is something that would have been way worse in real life.
It was actually the least gruesome looking of the deaths, but it was very viscerally upsetting nonetheless.
Yes.
And you focus on your own specialty, but as his head was coming out of that window, he got one shoulder out.
Like, oh
and
no.
It looked like he was going to make it. And that second shoulder just got stuck. And I was thinking, shoulder dystocia, there are things you can do for
I was gonna
that.
say,
Get that poor guy out of there.
Did you want to push down on top of the oven?
Just push down on them and just try to push them out, or break that clavicle so it can come out.
Hey, you know what?
Just
If
one
you
more
gotta
good
do
push.
It, you gotta do it, right?
But that's OB that does that stuff, right?
Oh yeah, I just stand in the corner.
Have you ever had to be part of that? Because when they do dystocia, they're not messing around.
Oh, they don't mess around. They call it like it's a code shoulder, and every single person in the hospital descends upon this poor woman, and I stand in the corner.
I
Can you
like
explain-
that style.
Can you explain to our viewers who don't know what shoulder dystocia is?
No, it's okay.
No. That's a really funny thing.
That's fair.
We have to
actually.
explain this. Can you please explain what shoulder dystocia is to our...
Code shoulder.
And a cold
shoulder.
Not a cold
when
shoulder.
When a baby is born in the natural way, the head comes out first, and then the shoulders have to come out. And basically, you want to get like the largest part of the baby out, and then the rest of it just comes out. But sometimes one of the shoulders gets hooked up on the mother's pelvis, and so the baby gets stuck. And whenever a baby gets stuck coming out, you worry that they're not getting oxygen, there's pressure on the cord, and it can be life-threatening. So when it is identified that there is a shoulder dystocia or a baby is stuck because one of the shoulders is caught on the mother's pelvis, there are maneuvers that you can do to get that shoulder to dislodge itself and have the baby deliver safely. But these maneuvers involve pressure on the mother from above and changing the position of her legs and things that are not comfortable things to watch or to experience, I would assume.
Things that you can't do to an oven.
Probably cannot do to an oven.
Yeah, how would you adjust the oven legs?
I will tell you, there are clavicular fractures that help babies get out, and there are, things that are not ideal, but ways that a human body can get smaller to fit through.
So you would have broke that guy's clavicle.
I would have.
Let's
get him out of there.
You wouldn't raise the oven's legs up or turn it to the side.
I
don't even think suprafrontal pressure is a thing anymore. I don't remember any of it. It's like in medicine.
There are maneuvers. Like I said, I stand in the corner.
I'm just because I've already made one friend's joke this evening. I'm just thinking pivot.
Exactly. I love that episode.
Oh, terrible. Can I mention one of Jigsaw's best lines in this movie? Quote, "I'm not fixable. I've had cancer." And then right after that, they show the scene of him getting into a car accident with a massive rod through his side. Yeah. And then he just yanks it out and just lies there on the side.
He had cancer of the rod.
Yeah. So that he cured himself then because he removed the entire rod.
Well, these are two separate incidents. He got the diagnosis that he has cancer. He decided he's going to kill himself. He drives his car off of a cliff, but he survives. But he ends up being impaled by something.
Yeah.
Gets out of the car,
decides he wants to live.
Right.
And that's a rodectomy.
See? Another near-death experience, and now he has tasted the joy of life and wants to live.
But pulling out the rod, bad idea.
Yeah. You leave the rod in.
So you get help.
If you are impaled by something and you are alive.
you want to stay alive because you have a new lease on life because of your accident, because of your diagnosis.
Well, and that's the key, though. Wasn't he trying to kill himself?
But then he wasn't
But he wasn't.
Yeah, so if you get stabbed by something and it's still in you, or like in the movies when people get shot and there's a bullet, like you don't remove things that aren't causing damage. And so for in his case, he was doing okay enough. I mean, yeah, you don't want a rod sticking out of you, but you leave that to professional people. That rod could have pierced something, but it's also holding it closed, so it's not causing you to bleed everywhere.
Yep.
Or by pulling it out, you could slice something open that was otherwise undamaged. You want to do nothing. You want to not touch that as much as possible.
There might be one situation where you might need to remove the rod. That was a pretty long rod, and he couldn't go anywhere to get help.
That's true. And so that's when your risk benefit is this going to cause more damage if I don't do something?
Or do I just lie here and die?
Usually when someone has an accident like this and there are professionals around, they will shorten that rod to make it less...
So you fit in the ambulance.
Right, yeah. Exactly. Yeah. This is a tough call. I don't know. I would have pulled it out. You shouldn't, though. That you are more likely to do damage by pulling it out than by leaving it in.
Yeah.
And it's going to look weird when you start breathing, because it's going to move.
Ooh.
Just slowly sliding in and out. But that's just terrible. And Courtney has now covered her face because she is cringing. Speaking of cringing, though, can we go to like the cringiest one, Xavier's Game?
No, I don't want to talk about this.
No, we're talking about Xavier's Game.
So Xavier's Game is the one... So Xavier was a drug dealer.
Correct.
And so to get the antidote to the sarin gas, or the Kirkland brand sarin gas that he was using...
I prefer Great Value.
Let's not brand shame Costco, okay?
That's why I'm brand shaming Walmart.
The Great Value brand sarin gas.
You knew that too quickly.
The antidote was somewhere in a...
It was not the antidote. It was
the key to an antidote.
I was going to say that. I also thought it was antidote initially, and then it was glowing green, and I'm not injecting that.
Yeah. But was inside basically a kiddie swimming pool full of hypodermic needles.
Yeah.
And syringes.
Used.
Well, it's supposedly used.
Used.
There was stuff in them.
Yeah. Okay.
There was extra fun stuff in there.
And this was something that was like a little uncomfortable for me. But the three doctors in the room were like me during Human Centipede or the eye stuff in this movie.
I mean, it's pretty cringy.
I think it's
not cringy in the this is wrong way, cringy in the oh I'm so uncomfortable way.
It's a little both, actually.
I mean, I have been stuck by a needle. Granted, it wasn't after it was used in a patient, so it was not a big deal, but it is like it puts a flash of a lot of stuff in your brain.
Yeah.
And you're taught very, like, it is hammered into you, needle safety, sharp safety, like, don't get stuck by anything. Also, don't accidentally stick somebody, because that's a thing that you can do while you're trying to help. And so to see just a big, like...
Dozens.
Like a
Not dozens, hundreds.
like
Hundreds.
a swimmable
Well,
amount, like
right.
a Scrooge McDuck amount
Yeah.
of used needles,
Yeah.
and then somebody falls into it, which is one thing. Like, that is enough.
Thrown into it.
Thrown into it.
And it's not even when she starts to move around, because that sucks. But when she drags her foot through it the first time, I was just like, oh, it hurt. It hurts.
Yeah.
It hurts to talk about. And you know what? I don't think I connected in my brain why the three of us cringed so much.
Yeah.
But I think you're right. I think it is the needle sticks that dig into you.
And you'd be surprised how many patients I do see on a relatively regular basis where they come in with needle sticks from like the playground and whatnot.
Oh.
And then when I call like infectious disease or whatnot, the risk of transmission is really, really low.
It's very true.
However,
But it's there.
that's a lot of needles,
Right.
so your risk immediately goes up.
That's where said she had dozens. There were dozens sticking to
Sticking
her.
in
Like,
there.
as
And that's
she
not
came
even
out.
all the ones that got her, because
Yeah.
some of them were not sticking to her.
Yeah.
And also, some syringes are glass, and that's the other thing that it's just like, everything about that is so cringy.
Yeah.
It hurt me to look
I
at.
felt like watching
That's
it,
the
though,
only thing I remembered from this movie.
she's more likely to get a MRSA infection than like HIV or hepatitis, which is, I mean, that's everyone's big fear, is stepping on a needle in the playground or whatever, that you're going to get HIV. But really, you're more likely to get some kind of bacterial infection because it's just dirty in general.
Yeah.
And all of those, she wouldn't, like, if she lived to deal with MRSA or hepatitis or HIV, she would have gotten through the knockoff sarin gas.
Yeah.
Probably.
So this is actually
She's-
best case scenario.
She's got a high constitution.
Yeah.
Well, infection aside, it just hurts.
Yeah.
Like, you describe pain as, oh, it feels like a million needles are sticking me. That's what happened to her.
Yeah, that's literally what she's living the nightmare of 10 out of 10 on the pain
Yeah.
scale.
And can I also say, it's also the complaint that we have for every Hollywood movie. It wasn't bloody enough.
Yeah.
No, there was no blood.
It's
More
hard-
needles.
It's hard to say because
That was a lot of needles,
But that's a lot of needles, and she was flailing.
Flailing.
Like,
That's true. She was digging, and there were some. When the needles stuck out of her, there were blood drips from those sections too. But
Also, you're going to be real sore.
can we talk about?
Yes, but really quick question. A syringe is what holds the drugs as opposed to the needle, which is the needle.
The needle is the pointy end.
I always think of the syringe as being both.
Think of Iris Stark.
There you go. You stick him with the pointy
sticking with
end.
the point.
Is
Her
that-
thing was called needle, right?
Yeah.
That took me a minute.
It wasn't called syringe.
That was a good reference
It was
that
a
I made.
very good reference.
Please listen to Johnny's other podcast, Got Thrones. Thank you.
So just about transmission in general, I think that's worth talking about for a second. Like Jackson said, if you do get a needle stick randomly somewhere, it is less likely that you're going to get some disease and more likely that you're going to get a bacterial infection just because it's dirty. Transmission of any disease through something that doesn't have fluid blood in it is pretty low. It's still gross. It still makes my skin crawl to think about it. I would still get checked out by a doctor.
Oh, yeah.
But it's just low likelihood of having serious disease. The one you're most likely to get is hepatitis. That one is transmitted way easier than HIV. But if you got stuck with a needle, there's almost no way that you could not freak out about it.
Mm-hmm.
It's just more likely than not, nothing is really going to happen other than you might get a nasty wound that needs some treatment.
It still makes me shiver.
Yeah, that's why sort of live needle sticks are worse, because there's liquid blood.
There's
like
blood in them
Yeah.
typically. Yeah, the hollow needle.
This one all looked dry and just grody.
I mean, it would be.
but they
It
were
would. I would be
used.
freaking out. I would be vomiting. I'm sure that I would be vomiting out of fear.
that would make that scene a lot more interesting, though.
Well, and
Adding more vomit.
Just vomit everywhere. Oh my god, I got bleh. Just over and over and over again.
medicine aside and back to human interactions, everyone seems kind of okay that he threw her in there.
Yeah.
Yeah.
that is...
I mean, like, upset and, oh, that wasn't cool, but it wasn't like the...
It wasn't get her out.
I'd like to think that I would have kicked him in afterwards, but I don't think so.
Yeah.
I think he was a pretty scary guy. He's supposed to be a scary guy. I'm scared of him.
It actually made me think this is more of a screenwriting thing than a doctoring thing, but it made me feel like they had a relationship beforehand that they did not. That it was like that they had some sort of past.
But they did.
They were all connected by a common bond.
They were all connected by a common bond, but they didn't know each other.
Oh, okay.
They just knew the same Dirty Wahlberg.
Dirty Donnie Wahlberg?
Yeah.
Donnie Dibs.
The old DDW?
Wahlburgers is not sponsoring next week.
Yeah. What did you guys think about the girl from Seventh Heaven who had the really bad seizures?
My favorite story about seizures is we had a girl come in to RER, and this was before, I think I was a medical student, it was before I started school. But the story was she was having a seizure, and there are things that you can do to determine if someone is having a real seizure. Jackson, I'm sure you do this in the emergency room all the time.
I do this a lot.
But one of them, and my favorite one, is you hold their hand over their face, like above their face, and you let go. And someone having a seizure, their hand is going to fall directly onto their face and not feel right. Mm-hmm. Someone having what we call a pseudo-seizure, or not a real seizure.
We call them psychogenic, non-epileptic seizures.
That hand inexplicably falls to the side of their face, even though it started directly above them. And so the ER physician in charge kind of recognized what was happening, and this girl had like a prominent father, and he gets up right next to her ear and he goes, "Stop it." And immediately the seizure stopped.
So my favorite story about like fake seizures was I had one girl who was seizing on her face, and she was seizing kind of like how the girl was in the movie, like just writhing around like a flopping fish out of water, just flopping up and down. And I just said, if she keeps flopping like that, her face is going to get real messed up.
Okay.
So then she turned her face to the side so that her face wouldn't get messed up anymore. And I just go, I got the diagnosis, you guys. But that seizure looked terrible. Like, going back to the movie, she didn't turn blue, she wasn't foaming at the mouth, and then she just died.
Well, and it was kind of intermittent too. Like, it was pretty, serious and jerking, and then she kind of got.
And then the camera was off her for a second.
With it. Exactly, she got a little bored. The camera was
tiring.
Off. Someone else was talking or something, so she settled down a minute, and then it was right back into it.
It is tiring. People that have the tonic-clonic seizure, that's like where part of your body is shaking. That's all of your muscles are firing, and it uses the energy of all your muscles firing, or whatever muscle group is firing. But it is tiring. Usually people that have seizures, they are exhausted afterward, and they go to sleep.
They go nap for a long time.
Don't say nap.
They go nap for a while.
The medical term for that is post-ictal, but
correct.
Nap
post-ictal
is...
state.
Yeah. I just love that one of the tests for is it a real seizure is stop hitting yourself.
No joke.
Well, so and then
no, it's start hitting yourself.
Start hitting yourself. Did you stop hitting yourself?
Basically, put them in a situation where they might feel something,
where they would make a conscious choice to avoid it.
The other time I actually stopped a seizure was I said, okay, we really got to do a drug test, and if we can't get a urine, we're gonna have to put in a Foley catheter, and then I described it in just gruesome detail. Like, we got to clean the area with really cold, like, soap and betadine, then use this really big tube and just trying to stretch out the opening of the urethra and pass that tube in. And then we'll inflate a balloon in the bladder. And the minute I said the word inflate balloon, done.
So I have a question for you guys, because I don't typically take care of adults. But in neonates, when someone seizes, when a patient starts seizing, we look to see if the movement is suppressible. So if I have a baby who's twitching their arm and it looks like it could be a seizure, I will hold that arm, and if I can stop the movement, it's typically not a seizure. Yeah. It's something that we call myoclonic jerking, which is kind of a muscular thing, and we worry less that it's something, neurological that's going to cause a seizure. Yeah. Can you suppress? Is that similar?
Yeah, I mean, we do the same thing for patients that we see in the ER with seizures all the time. Is like, if I hold their arm and they're still shaking through that, then I'm a little more worried that it is a real seizure.
One big difference is that our patients can talk to us. And so that usually informs the situation a little bit better.
Yeah,
so you don't.
When they're faking it,
it's right.
They're seizing,
I think you can correct me, please, if I'm wrong, but pseudo-seizures are a thing that's kind of not really an adult population. That's more like kids and adolescents.
Incorrect.
Really?
Yeah, it can actually happen in adults.
I know, I'm not saying it can't. I'm saying it's
very popular. It's not popular, but it's very common in the adolescent
all the rage
population. However, one of the big risk factors of having a psychogenic non-epileptic seizure is actually having the diagnosis of a seizure.
Okay.
Once
they know that they can do it.
Or knowing someone with seizures.
Okay.
So those are actually some of the biggest risk factors to having
like
that.
attention getting?
Oh man, I had a seizure as a baby. Could I start having
a lot of people
could I start faking seizures?
A lot of babies have seizures, but they're not seizure disorders.
Yeah, there's something called febrile seizures where a child, typically 6 months to 6 years, has a seizure immediately before or during a very high fever.
That's
not high fever.
It's a quick advance to the temperature.
That's the one.
But usually it ends up as a high fever.
I hate
and usually that.
I have to do this talk every day, so that's why.
So if I have a fever, I'm going to have a seizure.
Yes.
No.
But typically that does not indicate a lifelong epilepsy syndrome.
It increases the risk.
I was just wondering if I was at risk to start faking seizures.
Whatever you do on your fun time is all you.
I'll do it on the podcast.
Yeah.
I'm going to give you a green light to that.
This is a curiosity question. Are pseudo seizures is that someone who is doing a pseudo seizure, or is it like, this is my maladaptive coping mechanism and my brain is making me do this?
I think it could be both.
It's both.
Right? Or either, I should say.
Either or. Yeah, it could be either or. They might not know they're doing it, or they know they're doing it. It could be either one.
Okay.
Usually the ones that know they're doing it, it's really obvious, and they're horrible
because
actors.
they look like someone in a movie who's doing a seizure,
Correct.
as opposed to someone who's having a seizure.
It's hard to fake medical illnesses.
Yeah.
We have a lot of tests.
Yeah, you can't put your thermometer under a oven or something.
You can, but the thing is, your temperature of 120 is not survivable.
It's typically a red flag.
Home Alone, they do that. Or no, Ferris Bueller, they do the hot water bottle.
No, that's different. In Ferris Bueller, he licks his palms. In Ferris, that's the whole speech he gives, because with a phony fever, with a nervous mother, you might end up in a hospital.
Yep.
So what I do is I fake a stomach cramp, and when I'm bent over moaning in pain, I lick my palms. Sweaty palms is a good non-specific symptom. It is. It's a great one. I'm sorry, Ferris Bueller is the only perfect movie I can think of. It is an amazing movie. I don't want to get into this.
Princess Bride.
It's pretty good too.
Can I bring up something Greg...
Hold on. I have a real... Wait, now I don't remember what I was asking.
So yes, you may bring it up.
Can I bring up something Greg brought up?
Yes, you can talk about me.
About something that Donnie Wahlberg did. And about how angrily he stomped onto...
Oh, yeah. Oh. So at this point in time, Donnie Wahlberg, who has a name and it's Eric, we know this because it's screamed all the time, is trying to beat the information about his son out of Jigsaw, and he curb stomps him.
He does a lot of stuff. People that have advanced cancer diagnosis, that's where cancer is kind of spread throughout the body, or they've had cancer for a long time and their body is deteriorating around them. They really, he looks frail in this movie, and people are actually frail. Their bones are more brittle. They have a tendency to have very thin skin, and they can have skin tears and bleed easily. They're just kind of overall not working properly. So the idea that somebody who is a patient in that state can get into some sort of fight with someone who doesn't destroy them completely, like the way that Eric stomps on Jigsaw, I mean...
He stomped on it like he was trying to put out a dog poop bag on fire.
Exactly. He stomps on him so hard that he would have broken he would have just collapsed his rib cage. It would have been the most disgusting thing ever. And then you see 2 seconds later, he's punching him in the face. It's just, people that are that brittle are actually pretty brittle. And he would have destroyed this person.
Yeah, that one was a little cringy. Because he really wound up for that one, and he went for it. So then, kind of going on with the movie, there's that other girl whose name, I don't even remember what her name is.
Not Amanda, other girl.
Other girl, the pink shirt girl, when she kind of breaks off because she finds out the kid is like the son of the cop. Like puts her arms in the metal trap.
Tough
Now,
girl.
my non-doctor theory on this is this was Amanda's trap because Amanda was the one who slit her wrists and it was putting her hands in a trap. But they didn't go to any story on this room because they were near the end of the movie.
I think they were getting pretty lazy.
They just kind of ran right through it, didn't they?
Yeah. And then she just jams her arms up there, and then there's a bunch of blood and whatnot.
Well,
did you think that was enough?
What got me was she put one arm up there and then tried to get to the syringe, and it spilled.
She's not very bright.
And then she put the other arm in the other hole. Like, I mean, once your antidote is lost, you would think the other arm could be used to help free the first arm.
Yeah.
But
You could have freed yourself with just fingertips.
I think so.
It also didn't really feel like there was a winning scenario there.
There was absolutely a winning scenario, and it was having two people in there so that one person could put their hands up and push things away.
Yeah. But you still can't get the antidote. The antidote was wasted.
If you were holding the sides of the cage.
Or she could have jammed her... I think the point of that trap was she could jam her arm down and then push down, and then the injection would go into her arm. Not a valid way to deliver it.
That's assuming that antidote is intramuscular or doesn't have to be IV.
We just know that it's magic because we've not seen it applied anywhere.
But also the other thing about this movie and the theme of the whole movie is teamwork makes the dream work.
It's true, and that's true. And all of these traps, if they worked together, they probably would have had a better chance of success.
Except for get a shotgun through the face.
Except for looking through the shotgun people.
Yeah. They could have solved that entire puzzle in the first room and not have to do anything else.
Saw is about psychiatry. It is predicting human behavior based on... Psychiatry. Oh, Jack.
Oh, man. We gotta... I know what we're calling next year's Horror-October.
It's psychiatry.
For that knife trap, I wrote down... It looked like... The thing about cuts and bleeding is it depends on what you cut and what's bleeding. You can have superficial cuts on your wrist that aren't that big of a deal, and what was happening to her, that was an appropriate amount of blood. Except for if she hit something major, and because she's kind of moving around, and she's got razor blades pushed against all parts of her arm. I mean, I feel like not only would it be bleeding more, but she might be handless within a short period of time. She's also
real skinny, so she probably would have nicked something bad at that point already.
Well, and the way they were set up, too, was at that angle that, you can go in, but as you come out is when you start getting the...
It's like a Chinese finger trap.
Exactly. You've got two major arteries going through your wrist, the radial and the ulnar, and maybe she just didn't hit either of those.
Right, but I mean, if you look down at your wrist, you can see all those superficial veins and stuff. They bleed...
So I love that as we're talking about this, we're both looking at our wrists.
All of us are.
Holding them up.
So when Donnie Wahlberg brings Jigsaw to the Saw house, he was still attached to all of his IV stuff?
Yeah, that was actually my question the whole time was...
Like, did he bring that?
Did he bring the bag?
He started out like he was just hanging out attached to bags, no medical supervision whatsoever. Well, bags of saline, yeah. Would there be any reason for him to just be hanging out attached to IV bags throughout the course of the movie?
But I didn't see the bags in the van.
So I would be saying I don't know what they say in the movie.
Nothing. They said nothing.
I don't know what they said in the movie, but it's the way that he's presented, it sort of feels like he's getting chemotherapy. But definitely not. Any patient that is that ill, like, part of getting chemotherapy is you have to be kind of a certain amount of healthy. It kind of knocks your body down. And so patients who are kind of bedbound at home and psychopaths, presumably, are not getting chemotherapy. But they might be getting other types of therapy. So in my job, I do give people medicine through, not necessarily through their veins, but I do give them like subcutaneous medicine or through a port that they may have. And that's usually for symptom management, be it nausea or pain control. Pain control is the big one. It helps kind of get medicine in there faster. So that's a thing that he could presumably be having.
But be doing on his own?
And be doing on it. Well, I mean, somebody sent him the medication.
Spoiler alert, and later in the movies, you'll find out who sets all that
stuff. It seems like... Okay. resources aren't this guy's problem.
No.
True.
When you are rich enough, someone will come to you and bring you the medicine that you need. And also the bags that he had were large too. It looked like maybe 500 cc's of something in there. So it could have been like, when you get to a point, you're not able to take in enough liquids or, eat sufficiently. And so
Also,
some of that can be taken
also,
over
if it's
by IV.
chemotherapy, usually they do put like a bag over that because it's light sensitive. So light can actually destroy the medication itself. But one random question I'm going to ask you guys is, can you hide a key underneath your IV bandaging? Because that was a random thing that they did.
I'm not necessarily...
Enough tape will hide anything.
Normally, I would say no, but they did a very cursory search on that guy. They searched him for 2 seconds before saying he's all clear.
No. Not a police pat-down podcast.
They did not do an adequate job. He's also wearing a robe full of pockets, and pockets were not... They didn't do a good job. No. It is not a police pat-down podcast, but I will gladly be a guest on one and explain how things are done.
Random trivia, if you have cancer or leukemia or something like that, you're not supposed to be checked in the rectal area. You're not actually supposed to do like rectal temperatures or anything like that because they're at high risk for bleeding and high risk for infection.
What about it being exposed to sarin gas?
Ooh, that's a definite no-no.
Depends on the situation.
Are you trying to kill said patient?
But you guys talking about hiding keys makes me think about the eye thing again. It feels like that's a theme in this movie. And I got distracted before, but the way that I would hide a key behind an eye is you just got to snip those little muscles holding the eye.
Mm-hmm.
And I'm freaking Johnny out. There's a couple little tiny muscles that hold the eye and control which direction it moves, and you just release those muscles, and you could just
muscles?
You could slide some of them are the rectus muscles, medial rectal. Then you just slide that key underneath the eye to the side of the eye and put a little puncture in the back of the orbit, and you got it in there, no problem.
Good job, Saul.
You can get it pretty deep in there too.
Yeah,
you can. You can slip that thing way deep.
And then you could pop the eye back in. Although if they coughed, it might pop back out if you weren't going to do
Gold
Because
muscle.
if you don't have your muscles
Popeye.
holding it. Well, but then you also have the optic nerve holding it in there too.
Yeah.
But it would be, now you don't have any of the muscles. You know what? The thing about thought experiments is sometimes you realize
Shouldn't
you're
be thinking
sicko.
about it. Yeah. You probably shouldn't be thinking about it.
Yeah.
But yeah, kind of all of this builds to the final scene because, Jigsaw's telling Donnie Wahlberg, just talk to me, your son will be fine. He'll be in a safe and secure location. Emphasis on the word safe.
Yeah.
This whole thing is a guy, giggling to himself, making pun traps.
Yeah.
That means writing out what he's going to say exactly.
I think Jigsaw could have just had a career writing editorial cartoons instead.
In the New Yorker.
like something much less sophisticated.
It looks like this child's in a safe and secure location. Open safe.
I think I've seen that in the New Yorker.
or making mad fold-ins. Pour one out from Mad Magazine.
Find your child by folding in.
But yeah, he spent his time in throughout the course of the movie. It turns out Donnie Wahlberg's kid was in a safe with an oxygen tank.
Can you live?
Can you live for 3 hours? Let's say hour and a half.
There's a lot of what ifs in there.
There's a lot of what ifs because I'm a little dubious because if it's an airtight thing, eventually he's going to be building up a lot of CO2.
Well, he had an oxygen mask.
Right, but if it's airtight, you only have so much space in there to be anything.
I mean, the atmospheric air is mostly nitrogen, and then it's oxygen and something else that I can't remember. Hydrogen.
Yes.
But eventually you're gonna breathe in all that oxygen. Sure, you might have a supply for 2 hours, but you're making so much CO2 that the atmospheric pressure and all that stuff, you're not going to be breathing just oxygen at that point. You're going to probably suffocate if it's airtight.
But
that's safe to not look airtight. It looked like an old.
The best solution would for it be not to be airtight and for him to drill a couple holes in the back and.
Yeah. Oh, but who knows? And if you drill a couple holes in the back, then possibly someone could be making noise and calling attention to them. Although
saying
he looked pretty dead.
That those cops were pretty keyed up. I don't think they would have been hearing anyone knocking from the inside of a lead-lined safe. I'm assuming it was lead-lined. I'm just going to say
it looked pretty thick. It was just a dubious situation for that kid to be in because I don't think he would have made it, honestly. Because he was already kind of sick, and there was no way he could have lived that long to do all that stuff.
One more question before I get to the 2 big questions of the show. Going all the way back to the, 3rd or 4th scene, you guys both talk. So as the cops are storming the building, the cops are exposed to a trap. But let's talk about what you talked as a tib-fib fracture. Oh, that was the first time that all the doctors cringed.
Yeah, that was a good cringe.
And we just cringed again.
Yeah.
So, tib fib means tibia fibula, so that's the two bones of your lower leg. And I don't know what came out exactly, but just snapped that dude's leg.
Oh, so
it was like a bear trap sort of thing.
The stairs
It was like
flipped.
Yeah.
So he was walking up some kind of metal stairs, and then it kind of flipped over, and it basically, it's like a bear trap. It caught his lower shin.
I actually don't think it was just I think it slid so he could slide between the stairs, and then a piece was like
came through
and just snapped his leg.
Either way,
it was severe.
Metal parts closed over the lower section of his leg, and we all screamed.
Yeah.
So why is a tib fib fracture so bad?
So it's very thin thin tissue there. So when you cut through there, it's a pretty severe fracture. But also when you repair it, you're at higher risk for compartment syndrome too. So you can actually increase pressure in that area.
What's compartment syndrome?
So your leg's made up of a lot of different compartments, and if one of them swells up so much that it pushes on the nerves and the blood vessels, it'll cause a lot of pain and potentially lead to amputation.
Jackson, you're skipping over a lot of stuff and going right to compartment syndrome.
That's all I think of in the ER.
Do you remember the 5 P's of compartment syndrome?
Pain, pallor, paresthesias, pulselessness, and there's one more P.
Poikilocytosis.
Poikilocytosis?
Poikilo.
You lose temperature sensation.
It's my favorite.
So the tibia and fibula are the two bones that are in your lower leg. Jackson said that. This thing comes out, slams them, they break. These are weird bones. The fibula especially doesn't really do it. It's just like a thing that's there. But they're sort of thin bones that are also shaped weird. And so if you have a fracture like that, you could potentially have the bone come sticking out of your leg, which is whenever something like that happens, it's called a compound fracture. There's a couple examples of that during March Madness a couple years ago.
Oh yeah.
Oh yeah.
Oh yeah.
Yeah. And like it's just a thing that happens. It's especially when people are really really strong. You have a lot of forces acting on those muscles, and then you start putting lots of physics loads on them, and that's a horrible injury. It's happened in the NFL before.
UFC.
And yes, in UFC, I think I know exactly. What you're
Yeah, I know you know.
So that's the other thing. Like, it's not even seeing what happened; it's sort of knowing about the damage that can happen after it. Like Jackson was saying, because you start doing damage, and there are areas that are sort of sealed off from other areas in your leg, then you can get swelling because that's your body's normal response, and then that swelling itself can cause other damage. That is what compartment syndrome is.
Yeah, I'm just thinking about the Titanic now and
all the compartments,
all the various compartments.
Yes.
If one fills up too much, it's bad. So that's all you need to know about that part.
Question number 1 is a new one.
Okay.
Ooh.
Human centipede was 100% medically accurate.
In comparison.
In comparison, how many percent medically accurate is Saw 2? For an example, since this is the first time, I would call the Office episode The Injury 42,000% medically accurate.
I was going to say, this is going to be more than 100%.
Yeah. So how many percent medically accurate is Saw 2?
In my head,
Okay.
Human Centipede was, I think I said like 28% accurate.
I think that the marketing material said 100% medically accurate.
So,
Because math.
if I remember my SAT, and 28
Everything-
is to 100.
Everything is relative.
Slightly less than 4.
I think this is... they're not trying to do medical stuff, so it's hard for me to see... I mean, anything in there is plausible. Do I think there should have been more blood in one of the cases? Yeah, but...
The burn victim could have been more burnt.
Yeah, but also, who knows? Maybe...
Is the chemo a little bit off?
Yeah.
And, the energy for the...
I'd say it's probably 2 to 3 times more accurate than human
I would say...
centipede.
Yeah, I would say...
So let's go relative.
I'd say
I agree with
200 to
that.
300% more medically accurate human centipedes.
I think it's significantly more than that.
You think?
I think maybe 700% more accurate. This movie's... There's nothing crazy about it.
700% medically accurate.
There's a little
200 to 300% medically accurate.
Yeah.
I'm going to go 5.
500% medically accurate.
I'm cynical.
You're wrong. It's
There's
700.
a,
It's very clear.
there's a little bit crazy in there.
A little
But
bit.
As opposed, when everything is relative and comparing it to Human Centipede, yes.
I think the things that make it crazy are more
Kind of.
physics-based as opposed to medicine-based.
I would say the chemo thing was kind of me.
Nobody says anything. That's in your head.
That is in my head.
You think that's chemo.
It might
But
not be
the
chemo.
burning thing didn't.
That burning thing is the most egregious one.
And the sarin gas, the presumed sarin gas, that part wasn't very accurate either.
All right, probably 500%.
Winner.
All right, and how would we make this film more medically accurate?
Everyone needs to be juicier.
Yeah, no, I mean, unless there's a reason for people to be coughing up blood, there's no... Why is it in there?
Yeah. I mean, I get artistically it is very clear and whatnot, but you can also definitely make them much more juicy because of the sarin gas and just having them leak everywhere.
Much more juicy.
Juicier.
It's kind of funny. Our commentary is that there is too much blood and not enough blood.
Yeah,
there's not too much and
too
not
much
enough.
blood.
Get it right, Hollywood.
Yeah.
Too much blood, not enough juice.
Yeah. You need more juice. That's the whole point of this whole thing. But yeah, and then everyone should be chasing harder for needles and getting their shots.
Yeah. We hardly brought up the fact that there was apparently an antidote to sarin gas that would be hanging out in a safe. Is that reasonable?
There is an antidote. It's atropine. The treatment for an organophosphate is atropine. So that would be what you would use to dry yourself up.
Ladies and gentlemen, that is a test question.
It is actually a test question. So that's the only medical advice for real thing.
Med students, tweet this episode out. At the end, there's an answer.
But yeah, atropine is what you're supposed to use. It's also what you're supposed to use if you got the same, was it the VX toxin from The Rock? That's actually what you're supposed to use too. And you're supposed to stab that directly into your heart.
No.
For once.
You don't really need to
Stop.
stab it.
Okay.
You're never supposed to.
You need to get it into your circulatory system.
No, but in The Rock, that's what Nicolas Cage does. Right in the chest.
You want me to stick this into my heart? Are you nuts?
We should talk about that movie.
That's on the list.
That's on the list.
I can't wait.
Yeah.
That's going to be a terrible one.
So, possibly for the rest of Horror-tober. We'll be talking about we're talking Final Destination or something else. We'll see how things work out.
Yep.
But otherwise, either way, actually, we will see you guys next week. If you want to do the intro to the show, you can record it and send it to hieverybodypodcast@gmail.com. And yeah, we will see you guys next week. Thanks to Greg and Courtney for being here, and thanks everyone for listening.
We'll see you next week.
Thank you.
Hi everybody, A Bad Medicine Podcast is hosted by Dr. Jackson Vane and me, Johnny Kolasinski. Thanks to Laura Williams for our intro this week, and thanks to Dr. Greg Winter and Dr. Courtney Nicholas for joining us on the show. If you have any questions or want to send us an intro, hit us up at hieverybodypodcast@gmail.com or on Facebook, Twitter, and Instagram at hieverybodymd. And one more time for those of you in the back, this podcast is not medical advice.